You might feel fine today. You're still moving, still smiling, maybe even telling yourself, a little fatigue is just part of getting older. But what if I told you that your kidneys could be silently screaming for help, and you wouldn't even hear it? I remember brushing off my tiredness, blaming it on age. I'd come home, kick off my shoes, and see my feet swollen like balloons. I thought, maybe I've just been on them too long. Then there was the foamy urine. Strange, but I didn't think much of it. But those were my warning signs. Quiet ones. Ones I wish I'd paid more attention to sooner. Here's the truth, our kidneys work around the clock, filtering blood, balancing fluids, keeping our bodies clean. But when they start to fail, they don't shout. They whisper. And those whispers are easy to miss. Today, I'll walk you through 7 silent signs your kidneys might be in danger. And even more importantly, I'll share what you can start doing right now to protect them, and possibly prevent something worse down the line. When I hit my 70s, I started noticing little things: more naps during the day, getting up 2, sometimes 3 times a night to pee. I figured, well, that's just what happens when you get older. So I ignored it. But then my routine checkup showed something I didn't expect: my kidney function was starting to decline. I was shocked. I felt mostly fine. But here's the scary part, so do most people. Did you know? 1 in 7 adults in the US, that's about 37 million people, has chronic kidney disease, CKD. What's even more frightening? 90% of them don't even know it. And if you're over 60? Your risk jumps significantly. In fact, according to the CDC, nearly 2 in 5 people aged 65 and older are already in stage 3 kidney disease or higher, often without symptoms. But here's the hopeful truth. If you catch the signs early, even subtle ones, you can take action. You can slow the progression. You can protect your kidneys and your quality of life. Don't wait until it's too late. In this video, I'll walk you through 7 silent signs your kidneys may be in trouble, and simple steps you can take to stay ahead. Sign 1: persistent fatigue and brain fog. You ever feel like you've been hit by a truck, and you haven't even done anything that day? You wake up tired, drag through the morning, and by afternoon, your brain feels like it's wading through molasses. Sound familiar? That was me for months. I'd nap twice a day, and still, I felt like I hadn't slept a wink. And the fog? I couldn't remember where I left my keys. I'd lose track in the middle of conversations. I chalked it up to age, until my doctor said something that stuck with me. Your kidneys may be struggling, and they're not filtering waste like they should. Why this matters? Our kidneys aren't just fancy filters. They're vital organs that quietly manage waste, balance electrolytes, and keep your blood clean. But when they're under stress, waste products and toxins start to build up in your bloodstream. And guess what one of the first casualties is? Your energy. Your focus. Your clarity. In fact, kidney-related fatigue isn't like ordinary tiredness. It's a deep, unrelenting exhaustion, one that rest can't fix. And the mental fog that comes with it can mimic symptoms of dementia or depression, especially in seniors. Did you know? Studies show that more than 70% of people with chronic kidney disease, CKD, experience significant fatigue. According to the National Kidney Foundation, early-stage kidney disease often presents no pain, but fatigue and mental fog are among the first red flags. Seniors often overlook these signs, thinking it's just getting older, but it could be your body trying to tell you something serious. What you can do. If you've been feeling off for weeks or months, especially with no clear cause like poor sleep or stress, don't brush it aside. Talk to your doctor. Ask for simple tests like a creatinine blood test, eGFR, estimated glomerular filtration rate. A basic urine test. These can detect kidney issues long before more serious symptoms show up. When I adjusted my lifestyle, started drinking more water, reduced my salt intake, and added kidney-supporting foods like berries and leafy greens, I noticed a difference. Slowly but surely, my energy came back. I didn't need 2 naps just to make it to dinner anymore. Sign 2, swollen ankles, feet, or hands. Have you ever taken your socks off at night and noticed deep, puffy indentations around your ankles, like the elastic band carved a trench into your skin? Or maybe your shoes fit just fine in the morning, but by afternoon, your feet feel tight and heavy, like you're walking on balloons. I used to think it was just water weight or maybe the weather. But as it turns out, that kind of swelling, especially when it sticks around, can be an early warning sign that your kidneys are having trouble. Your kidneys don't just filter waste, they also regulate the balance of fluids in your body. When they're not doing their job properly, extra fluid starts to build up in your tissues. That fluid has to go somewhere, and it usually ends up in your extremities, like your feet, ankles, or hands. This condition is known as edema, and it's often one of the most visible signs of kidney dysfunction, especially in older adults. It's not just cosmetic. It's a flag. Visual clues to watch for. Deep sock marks that don't go away quickly. Puffy or shiny skin around the ankles or tops of the feet. Rings that suddenly feel tight around your fingers. Shoes that feel snug by the end of the day. I used to joke that my feet had their own weather forecast, but in reality, it was my body crying for help. According to the National Institute of Diabetes and Digestive and Kidney Diseases, up to 40% of adults with early-stage kidney issues experience fluid retention, many without realizing it's connected to their kidneys. Studies have shown that persistent lower limb swelling in seniors is often linked to underlying kidney, heart, or liver dysfunction, not just inactivity or aging. What you can do. Elevate your legs for 15 to 30 minutes a few times a day to help move fluid back toward your core. Cut back on sodium. Too much salt worsens fluid buildup by making your body hold on to more water. Monitor your fluid intake, but don't drastically reduce it without a doctor's advice. It's about balance, not deprivation. Talk to your doctor if swelling is persistent, worsening, or accompanied by shortness of breath or weight gain. When I finally mentioned the swelling to my doctor, he ran a few blood and urine tests. My kidney numbers were just on the edge. But because I caught it early, I was able to make changes, diet, movement, and medication, that helped turn things around. Sign 3, changes in urine. You might not think twice about your urine. Let's be honest, it's not exactly dinner conversation. But sometimes, the quietest signals speak the loudest. I remember waking up 3 to 4 times a night just to go to the bathroom. At first, I blamed tea, age, even stress. But then I started noticing, the urine looked different. Sometimes bubbly. Other times dark. And once, there was even a hint of pink. That's when I knew something was off. What to watch for. Changes in urine are often one of the first signs your kidneys may be under stress. And yet, it's one of the most ignored. Here's what to keep an eye on. Foamy or bubbly urine. This could mean protein is leaking into your urine, something healthy kidneys normally prevent. It's like the foam you see when you shake up a protein shake, only it's coming from inside you. Frequent nighttime urination, nocturia, waking up multiple times to pee, may point to impaired kidney function or even early signs of diabetes or an overworked bladder. Blood in urine, hematuria, even a faint pink tint should never be ignored. It can indicate inflammation, infection, kidney stones, or more serious damage. One study found that 1 in 5 people with visible changes in their urine had early kidney dysfunction, and most of them had no idea. Why it happens. Your kidneys filter your blood to remove waste, excess fluids, and toxins. When they're damaged, protein, blood, or waste products can leak into your urine. You may produce more, or less, urine than usual. Urine color or odor may change. It's your body's way of saying, hey, something's not right. According to the National Kidney Foundation, over 30 million US adults have chronic kidney disease, and many only discover it after noticing changes in their urine. Foamy urine is a red flag for proteinuria, which can be an early sign of nephropathy, especially in seniors or those with high blood pressure or diabetes. What you can do. Observe your urine regularly. Color, smell, frequency, and foam all matter. Hydrate consistently. Dehydration can concentrate your urine and stress your kidneys. Don't ignore small changes. Even a weird day or two can be your early warning. Request a urine test from your doctor. It's quick, simple, and could save your health. Sign 4. High blood pressure. You know how they say high blood pressure is the silent killer? Well, when it comes to kidney health, it's a silent partner in crime. I remember my doctor looking at my numbers and saying, "Your pressure's creeping up again." I brushed it off, figured it was stress or too much coffee. But what I didn't know back then was that my kidneys were quietly struggling, and my blood pressure was trying to tell me. High blood pressure doesn't just affect your heart, it wreaks havoc on your kidneys too. And the worst part? It works both ways. Your kidneys help regulate blood pressure by controlling fluid balance and releasing certain hormones. But when they're damaged, they can't regulate that pressure properly, and it starts to spiral. Here's the kicker. Nearly 90% of people with kidney disease also have high blood pressure. National Kidney Foundation. It's a vicious cycle. High BP damages blood vessels in the kidneys, and weak kidneys can't control pressure anymore. What to look out for? You may not feel high blood pressure. That's what makes it so dangerous. But over time, it quietly damages kidney tissue, worsens existing kidney disease, increases risk of stroke, heart attack, and kidney failure. And it all might start with a few overlooked numbers on your monitor. What you can do. Check your blood pressure regularly. Home monitors are affordable and easy to use. Watch your salt. Seniors should aim for less than 1,500 milligrams of sodium per day, that's under a teaspoon. Get moving. Just a 30-minute daily walk can lower blood pressure and support kidney health. Talk to your doctor if your BP readings are consistently above 130/80. Sign 5. Metallic taste or bad breath. Have you ever bitten into your favorite meal, and it just tastes off? Maybe even a little like you're chewing on a coin? I thought I was imagining things when food started tasting strange. I even blamed my cooking at first. But the real issue wasn't in the kitchen, it was inside my body. My kidneys weren't filtering out waste properly, and the toxins were showing up in my mouth. The hidden reason behind the taste. When your kidneys are healthy, they filter waste, like urea, out of your bloodstream. But when they start struggling, urea builds up in your blood. It breaks down into ammonia inside your mouth. This causes a metallic or ammonia-like taste and bad breath, often called uremic failure. It's not just unpleasant, it's a red flag that waste is piling up inside you, poisoning your system slowly. In later stages of kidney disease, up to 90% of patients report changes in taste and smell. American Journal of Kidney Diseases. And many people notice these symptoms long before they get officially diagnosed. What you can do. Stay hydrated. Water helps flush waste and keep the mouth fresher. Watch for changes. If things start tasting strange or you notice persistent bad breath, don't ignore it. Talk to your doctor. They may recommend simple blood or urine tests to check how your kidneys are working. Listen to your body. Even strange little symptoms like a funny taste could be your kidneys whispering for help. Sign 6. Muscle cramps and restless legs. Ever been jolted awake in the middle of the night by a cramp so sharp it makes you sit straight up? Or maybe you get that itchy, creepy crawly feeling in your legs when you're trying to relax? I've been there, more nights than I can count. I used to think it was just part of aging. But what I didn't realize was that my kidneys were quietly struggling to keep up. Why it happens? Your kidneys do more than filter waste, they also balance your body's minerals and electrolytes. When kidney function drops, the balance of magnesium, potassium, calcium can go haywire. That imbalance leads to sharp, painful cramps, especially in the calves or feet, twitching or spasms, and for many, a frustrating condition called restless leg syndrome, RLS. This can make it nearly impossible to get good sleep, and your body can't heal if it's not resting. Restless legs are found in nearly 1 in 3 people with chronic kidney disease. National Kidney Foundation. Even mild kidney impairment can reduce nerve and muscle function, setting off these nighttime annoyances. What you can do: stay hydrated. Dehydration can worsen cramping. Ask your doctor to check your potassium and magnesium levels. Supplements may help, but only under supervision. Stretch regularly, especially before bed. Cut back on caffeine and watch your salt intake. Both can trigger muscle tension. Don't let your body's whispers become screams. If your muscles are talking, your kidneys might be too. Sign 7. Puffy eyes and facial swelling. Have you ever looked in the mirror first thing in the morning and thought, why do my eyes look so puffy? Maybe your face looks a little more swollen than usual, almost like you had a rough night, even when you didn't. Many people chalk this up to aging, allergies, or a salty dinner, but there's something more serious it could be pointing to: your kidneys. Why it happens? Your kidneys are responsible for filtering protein in your blood and keeping it where it belongs, inside your body. But when kidney function starts to decline, something called proteinuria can occur. That's when protein leaks into your urine instead of staying in your bloodstream where it helps build and repair tissues. When that happens, your body loses essential proteins like albumin, which help hold fluid inside your blood vessels. Without that balance, fluid leaks into your tissues. And one of the first places it shows up is around the eyes. Visual cue. If you notice persistent puffiness around your eyes, especially in the morning, even when you've slept well, it could be a red flag. It's often described as swollen or puffy eyelids, a baggy look that doesn't go away with rest, a bloated or tight sensation around the cheekbones and temples. Proteinuria, or excess protein in the urine, is one of the earliest signs of kidney disease and can affect up to 30 to 40% of people with reduced kidney function. National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK. Yet many people never notice, because puffiness around the face often seems harmless. What you can do: pay attention to your face in the mornings. Is the swelling getting worse? Check your urine for foam or bubbles, another sign of protein loss. Request a urine test from your doctor to check for albumin or protein levels. Reduce sodium and processed food intake, which can worsen fluid retention. Stay hydrated to help flush your kidneys naturally. Your body whispers before it shouts. Puffy eyes might not seem like much, but they could be your first clue that something deeper is going on. What you can do: simple prevention tips. Here's the good news: your kidneys may be quiet, but you can still speak up for them. Even small changes can make a big difference in protecting your kidneys from long-term damage. Whether you're trying to stay ahead of problems or manage existing risks, Here are a few powerful steps you can take, starting today. 1. Watch what's on your plate. Your kidneys are like a filter, and when that filter gets overwhelmed, it struggles to keep harmful waste and fluid in balance. The food you eat plays a massive role in how hard your kidneys have to work. Here's how to lighten the load. Lower your salt intake. Too much sodium raises blood pressure and forces your kidneys to work overtime. Aim for less than 2,300 milligrams of sodium per day, or less, if advised by your doctor. Cut back on sugar. High blood sugar levels damage the tiny blood vessels in your kidneys over time. This is especially critical for seniors with diabetes or prediabetes. Limit processed meats. Deli meats, bacon, and sausages are packed with sodium and preservatives that are tough on the kidneys. Eat more kidney-friendly foods. Leafy greens, berries, sweet potatoes, beans, fish, and whole grains, all rich in nutrients that support your kidneys and your heart. 2. Stay hydrated, but smartly. Water is your kidney's best friend. Staying hydrated helps your kidneys flush out toxins and maintain proper fluid balance. But don't overdo it, especially if you've been told to limit fluids due to heart or kidney concerns. Simple tips. Drink water consistently throughout the day. Sip rather than chug to support steady hydration. Avoid sugary sodas and artificial drinks, they add burden, not benefit. Add slices of cucumber, lemon, or mint to make water more appealing. Eating water-rich foods like watermelon, celery, and cucumbers can also boost hydration naturally. 3. Get regular kidney checkups. Kidney problems often go unnoticed until it's too late, but simple tests can catch them early. Ask your doctor about urine tests. Check for protein, a sign of damage. Blood pressure checks. High blood pressure is both a symptom and a cause of kidney problems. eGFR, estimated glomerular filtration rate. This blood test tells you how well your kidneys are filtering waste. Catching kidney decline early gives you the power to slow or even stop it. 4. Build a kidney-smart lifestyle. Your kidneys don't ask for much, but they do love consistency. Here's what to focus on. Exercise regularly. Even 30 minutes of walking most days can reduce blood pressure, support weight management, and improve kidney function. Get enough sleep. Poor sleep is linked to high blood pressure and increased risk of kidney disease. Manage chronic conditions. If you have diabetes or hypertension, staying on top of your treatment plan is crucial for kidney health. Avoid smoking and excess alcohol. Both can severely damage blood vessels and speed up kidney decline. Think of your kidneys as quiet workers in the background of your body. They don't complain until it's almost too late. But with awareness, care, and just a few lifestyle tweaks, you can protect them for years to come. Don't wait for symptoms. Take charge now. Have you noticed any of these signs in yourself or someone you love? Or maybe you've picked up a kidney-friendly habit that's made a big difference in your life? Don't keep it to yourself, share it in the comments below. Your story might just help someone else catch a warning sign early or feel a little less alone. If you found this video helpful, give it a like. It lets us know you want more content like this. And don't forget to subscribe for more easy-to-understand health tips designed especially for seniors who want to stay informed, energized, and in control of their well-being. Take care of yourself, you deserve to feel your best.